Hi, my name is Michelle Hidalgo and I'm going to talk about Ribavirin for chronic hepatitis E virus infection in transplant recipients. First, the definition. Hepatitis E virus is an icosahedral, non-enveloping, single-strand RNA virus that is approximately 27 to 34 nanometers in diameter. It has been classified as a single member of the genus Hep virus in the family Hepviridae. The antiviral drug ribavirin can clear chronic hepatitis E virus in solid organ transplant recipients, researchers reported.
हेलो फ्रेंड, वेलकम टू द चैनल सॉल्यूशन। आज हम बात करने वाले हैं एनिमेशन के थ्रू एक और एंटीवायरल ड्रग के बारे में। और आज का ये जो एंटीवायरल ड्रग है उसका नाम है रिबाविरिन। ये जो रिबाविरिन है उसका मोस्ट ऑफ तरीके से हम यूज़ करते हैं। तो जानते हैं कि हेपेटाइटिस बेसिकली हमारे पॉइंट ऑफ व्यू से दो तरीके से हमने क्लासीफाई।
Next, application in medicine. After more than a year of scrutiny and inspection by China's State Food and Drug Administration, an hepatitis E vaccine developed by Chinese scientists. HEV infection is usually self-limiting, except in patients with a suppressed immune system, where it can evolve to chronic hepatitis and cirrhosis.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use.
Now pros and cons. Pros. Ribavirin is a general antiviral that inhibits replication of many RNA and DNA viruses. It has long been used to treat hepatitis C, along with pegylate interferon alpha and now several direct-acting anti-HCV agents. Cons. Ribavirin is a safe treatment option for HEV infections. However, the optimal dose of ribavirin for the treatment of chronic hepatitis E remains to be determined as treatment failure may occur. The main side effect of the drug was anemia, which necessitated a dose reduction in 29% of patients, erythropoietin in 54%, and blood transfusions in 12%.
And I think it's important to first redefine hepatitis E and its risk. When hepatitis E was discovered, it was thought to be a hepatitis A-like disease, fecally orally transmitted, present mostly in developing countries with poor sanitation systems, poor water purification systems.
Not issued applied in Ecuador. Every year there are an estimated of 20 million HEV infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E. The national rate is less than 8%, but there's a possibility that there are asymptomatic patients.
Time constraints, complex cases, cumbersome technology. Doctors and nurses can't do it alone. No one can memorize everything. With 18 million diagnostic errors each year, it's time for a second opinion. at the point, so there's hair difference.
Conclusion. Ribavirin as monotherapy may be effective in treating chronic HEV infection. A 3-month course seems to be an appropriate duration for this therapy, though a longer therapy can be given to heavily immunosuppressed patients. Now, I'm going to talk about immunotherapy in renal cell carcinoma. Renal cell carcinoma is the most prevalent kidney cancer with nearly 63,990 cases diagnosed in 14,400 deaths in 2017. Approximately 25 and 30% of cases are metastatic at diagnosis, and 20 to 30% of patients would undergo surgical management for local renal cell carcinoma show metastasis.
Types of tumors, each derived from the various parts of the kidney cell and displaying salient genetic characteristics, histological features, and, to some extent, clinical picture. When it metastasizes, it has the tendency to spread to the lymph nodes, lungs, liver, adrenal glands, brain, or bones. While the exact cause of renal cell carcinoma is unknown, there are risk factors that increase the chance of developing it, such as smoking, high blood pressure, family history of kidney cancer, and obesity. The chance of developing renal cell carcinoma increases with the age, and males have double the chance of having it compared to females. Only about 10% of patients present with the classic
Now, application in medicine. The immune system interacts intimately with tumors over the entire disease process. The complex crosstalk between the immune system and cancer cells determines the eventual outcome, either inhibiting or enhancing the tumor development.
The one that we just heard from Dr. Bob Moser. And this is a phase 3 randomized trial that looks at bevacizumab with atezolizumab versus sunitinib in a phase 3 setting for advanced metastatic clear cell kidney cancer. So
Now, pros and cons. Pros. A spontaneous regression of metastasis after nephrectomy in less than 1%. Identification of tumor-associated HE that can serve as MHC. And cons, adverse events. Hypertension in 29% and increased ALT in 7% of the cases. This applied in Ecuador, the incidence of CRC is increasing. This has been demonstrated in several publications and regional and global administrative records. There are many advances in the management of carcinoma of renal cells. However, there are many patients who are diagnosed in an advanced stage, which in itself is an independent risk factor for a poor prognosis.
Checkpoint inhibition, that is actually a form of immunotherapy. So that whole class of therapy, what it essentially does is ramps up your own immune system and releases the brakes that the tumor created to slow down your immune system from fighting your own cancer. It lets go of the brakes so that you can fight the cancer yourself. And when it works, it is actually astounding. It's really quite remarkable. It doesn't work for everybody, but when it works, it's really quite remarkable. Well, interestingly, checkpoint inhibition, again, this immunotherapy approach, that has exploded on the scene for bladder cancer as well. And that is rapidly changing the paradigm for the management of advanced bladder cancer. And so there's active trials ongoing right now trying to figure out exactly what space that therapy should fit in. Should it just be in metastatic disease, or does it have a role in locally advanced disease, or even earlier stages? So that is probably the single biggest advance in the last couple of years, and it's just taking bladder cancer by storm.
Now the conclusion. Immunotherapy has changed the landscape of management of metastatic renal cell carcinoma. There are several ongoing trials. It has shown an effective alternative for renal cell cancer. Thank you so much.